Seniors, can you walk into your doctor's office and see them when you need to? Do you have your doctor's cell phone number? And can you call them anytime, day or night? At Dedicated Senior Medical Center, their only specialty is caring for seniors. Dedicated makes it easy to get the primary care you deserve. If your doctor isn't taking time to listen to you or isn't treating you like family, it's time to call Dedicated Senior Medical Center. Schedule a visit to find out more about the care you deserve. Call 813-359-1448. That's 813-359-1448. Appointments available now.
Welcome to Cafecito with Rosie on air, where you'll get to know local professionals, entrepreneurs, movers, and shakers, and how they're helping their community. Hear exclusive interviews from thriving individuals, get inspired, and learn from them. And now, your host, author, speaker, commissioner, Medicare broker, business owner, published author, and business trailblazer, Rosie Paulson.
Bienvenidos to Cafecito with Rosie on air. I am so excited. We are now in the month of March. This is Women's Month, and we are celebrating each and every one of women out there that they are making it happen. The she heroes, the sheroes, the lady bosses. Girlfriends, I got your back. And thank you so much also to Dedicated Senior Medical Center for being the sponsor of Cafecito with Rosie on air and for believing in what we stand here in this show. Today, I am excited to present a doctor that is actually one of the ones that I have not met personally, but I am thrilled to get to know having a cafecito with him right now. His name is Dr. Ajoy Kumar. Dr. Kumar has been passionate about making an impact in the community since he was a hospice volunteer, caring for patients today as board-certified family physician. Dr. Kumar loves to empower them and improve their health knowledge. It is rewarding to see patients recapture a version of themselves they thought that they had lost or thought they could never become. He says it's also an honor to work with seniors. They are a source of wisdom and inspiration. Hello, Dr. Kumar. How are you?
Good afternoon, Rosie. Thank you so much for having me here today. It's been a real pleasure, and it's a great opportunity for us to talk about what we do, not only at Dedicated, but also what we could do as a whole for the people in this area here. I think it's super, super important that we continue to work on uplifting people.
Yes, and I think that's one of my favorite things to do in my Medicare side of business. I'm multifaceted, but in my Medicare side business, I love to meet folks because they have a story. Each of them had made a change in their communities, in their lives, and again, you learn so much. I don't think I've ever will stop learning from the community I serve because they're just amazing. And they're the world changers, I call them, the last of the Mohicans, right? The new generations, we think twice before we run into fire to save somebody, but they don't. They will do it if they have to because they want to. And
I completely agree with you. These are some of the most amazing people. You wouldn't know it. That's why I always say don't judge a book by its cover. When you sit down and have a nice discussion with them, you realize the things that they have done, the things they have gone through, and the things that they're doing, and you realize, wow, these are some really amazing people here. They've gone through so much. They have so much internal strength, and we just have to help them along near their senior age and get them to a healthier status. And I will tell you, the majority of people that I work with, they want to be healthy. So it's really a pleasure to work with people that actually want to be healthy.
Yes. So tell me a little bit more about Dr. Kumar. Where are you from originally? What passion decided you to, what helped you decide to be a doctor? Just tell us a little bit about who you are as a person.
Oh, sure. So I am originally from India, southern India, a city called Bangalore. It's now the tech sector of, India, Southeast Asia. Moved over here when we were 5 years old. had some rough times, and parents separated. Mom took care of me. We kind of bounced around from cousins to cousin's house until we got situated in the Washington, D.C. area. Growing up there, you're surrounded by politics all the time. You're surrounded by, struggles all the time. So I understood the struggles that a lot of my neighbors felt and a lot of the folks were going through. And I guess I developed some level of empathy when I was that young, kind of watching these folks. And I've always wanted to just help people. I don't know what it was. I don't know what it guided me. I'm sure people will say that was God, but something guided me to help people. I really had no ambition of going into medicine or anything like that. Working in the D.C. area, you see so much, you come across so much. I was more interested in foreign service. And for me, working for an agency like the CIA or FBI was going to be what I wanted to do, and it's very different from what most people that come from my background do. I really wanted to give back. I really wanted to take part in the community and protect my community, so I went to do that. As time went on, going through school, there was no different from any other kid. Going through school, you had your struggles. You had some issues with coming across with all sorts of things, from racism to, being in areas where it was kind of people were struggling economically, and then going into school systems that were a little bit different at the same time too. So enduring all that, I knew which way I wanted to go, but I think other things wanted me to go in a different direction, which is fine. And I think one of the biggest changes that came across me, I was doing a remote sports television production in college for a good friend of mine who was my neighbor, who happens to be a producer director for ESPN currently. And he asked me to kind of tag along, learn the business. And I was learning the business, but there was always something pulling me towards helping people. I would always help out folks within the D.C. area. I would take part with my friends to help out folks all the time. And eventually, I just decided to make a decision. I could always continue doing television, but let me try the medical side. I didn't really know what I was going to expect going into there, but I think the first time that I volunteered had a major, major impact on me. And the first place that I volunteered was hospice, and I took care of a young gentleman who was probably about 2-3 years younger than me, who was in the dying process. And for me, going into a house, I didn't have any medical skill or anything like that. I was just there to listen. And quite frankly, sometimes when you're in hospice, now that I know now, the only thing you can do is just listen. Mm-hmm. So as I was listening to their story, his struggles, and he went through some significant struggles. I remember this vividly. His father came out the back and he said, I don't know where you came from. I don't know how you ended up here, but I never heard my son talk to me or talk to you about the things that he was going through. He never mentioned it to me. Wow. The father and the son had a very strained relationship, and he was in tears when he told me this. And he said, and he looked at his son who was on the bed, very frail, and he said, I am so sorry for what has happened the last several years. The son's mother died, and part of the son died, and so did the father, and the father stopped looking after the son, and the son ended up getting, an infectious disease that literally took his life. But what changed in this whole aspect was I was the presence that kind of brought them together. No training required, just sitting there, just listening, and just, oftentimes just holding his hand. So as you can imagine, a moment like that is very different from walking out of a television truck saying, hey, that was a great show. This is real life, right. Right. And this carried generations. So after that, I just got heavily interested in medicine. So I was looking at medicine in a very different light, and I volunteered more, and kind of one thing led to another, and ended up doing several medical missions, which I thoroughly enjoyed, and I do off and on here. And went into family medicine, delivered a lot of babies, took care of a lot of family members of other folks, and it was just been wonderful. Did a lot of advocacy stuff at the local, state, and national levels, took part in healthcare policy development, both at the state and national level, and continue to do that and advocate for patients. I'm a big believer of the following, When I was growing up, it was a struggle, and my community helped me. And the least I could do is help my community back. Now that I'm in a position of being a doctor and having that, everything that follows behind it, and advocating for the voiceless, and, doing those kind of things. So this is the kind of stuff that drives me. I love doing this kind of stuff. And I'm just so fortunate to have found an organization as in dedicated Senior Medical Center that believes exactly the same thing. You know, we should be the voice for the voiceless. We should help those that are in dire straits. This is something that I personally and passionately, firmly believe that is the reason why we are on Earth. So that's just a little bit of me here.
Awesome. And your office you're located in Largo, Florida, right?
That's correct. That's correct.
Yeah.
We're right down the road off of Almerton Road. It's a fairly new office. We got 2 physicians, a third one joining very soon, so we are growing as well. It's kind of interesting. There was a recent study that came out of the American Academy of Medical Colleges, American Association of Medical Colleges, saying that the majority of people that are going into medical school these days are females. And I am by far outnumbered here at the center. There's lots of females here. So Women's Month, Women's History Month is going to be played very well here in our center. And quite frankly, I have some really amazing physicians working with me, and they will do a lot of good for our community. I'm just so happy to be part of that.
Yes, and that is one of the most important things. And the reason why I also get involved in so many different things with boundaries, because everybody thinks I do everything. But it's because I love my community so much, and I know that if I somehow can impact my environment, it will help my community to make it better. That's what helps me to get up in the morning and keep going. So thank you so much, Dr. Kumar, for your calling, for finding your purpose and realizing that it is medicine and that you are helping our community get better. And our seniors need that. Our seniors need to be heard and need to be understood, because it is so important to have that relationship with them. Now, I know that we are going through sometimes that some a situation or season different from everybody else, right? So we all talking about COVID-19 and the pandemic. And I know one of the things that I want to talk to you about, and then just have some more feedback and learning, because this is about educating our community. And most of the people that hear this show are caregivers, right? So they are helping their parents with their decisions. And we're going to be talking about vaccines. I know that they are available now in a certain quantities, but why do you think, why are coronavirus vaccines, that's the correct pronunciation, vaccines, so important for older adults?
You know, this is a great question, and quite honestly, it needs to be asked, and we need to educate folks on what the vaccine is, what the vaccine does, and why it's so important for older adults to get this vaccine. So it goes like this, and there's lots of studies, and you could take, and I encourage people to do this. I encourage my patients to do this all the time. Go to the CDC website, read about it, get educated, learn about it. If you read about it, go talk to your primary care physician about it and get their feedback too. That's part of that patient-physician relationship. But in older adults, the higher the age, the increased risk for severe illness. The older you get sicker. It just happens like that because for a variety of reasons, the lifestyles that we live, the foods that we've eaten, all sorts of things like that. We age, our body starts declining. It's just part of the aging process. Now, the greatest risk for severe illness from COVID-19 is among those aged 85 and older. So what is defined as a severe illness? A severe illness is defined as hospitalization, intensive care use, or ventilator to help them breathe, or they may even die. That's what's defined as severe illness. So why is it so important that older folks get this kind of vaccine? It'll prevent severe illness in those above age 85. Now, there is also benefits as well, too, because 8 out of 10 COVID-19 deaths have been in individuals aged greater than age 65. And the CDC has some really interesting data here that I pulled here and talk about briefly. Now, in terms of those folks between ages 30 and 39, they're 2 times higher to get hospitalized due to COVID and 4 times higher to die from COVID. Now, you then move to age 65 to 74. Age 65 to 74, they have a 5 times higher hospitalization rate and a 90 times higher of chance of dying from COVID. 90 times higher, those above age 65. Now, you go to age 75, it's 8 times higher to get hospitalized and 220 times higher to die from COVID. And if you get to those over the age 85, it's 13 times higher